Diabetes mellitus is a condition in which the body cannot properly produce or respond to the hormone insulin. This results in elevated levels of sugar glucose in the blood, which is the main source of energy for the body. Like the human body, the cells in a cat's body need sugar in the form of glucose for energy. However, glucose in the blood requires insulin, a hormone produced by the pancreas, to unlock the door to cells. Insulin attaches to cells and signals when the time is right to absorb glucose. By absorbing glucose, cells in fat deposits, the liver, and the muscles get vital fuel while lowering levels of glucose in the blood. In type 1 diabetes, blood glucose concentrations are high because of a decrease in insulin production. In type 2 diabetes, glucose levels are high because cells in the body do not respond appropriately to insulin. In both type 1 and type 2 diabetes, cells cannot access the nutrients they need even though there is plenty of sugar in the blood, because insulin can't transport the sugar from the bloodstream into the cells that need it. Cats with diabetes most commonly suffer from the type 2 form of the disease. It is estimated that between 0.2% and 1% of cats will be diagnosed with diabetes during their lifetime. Risk factors. The most important risk factors identified for the development of diabetes in cats include obesity, increasing age, physical inactivity, male gender, and the use of glucocorticoids, steroids, to treat other illnesses such as feline asthma. In some countries, Burmese cats appear to have a higher risk of developing diabetes than other breeds, but this may not be true in the United States. Obese cats are up to 4 times more likely to develop diabetes than ideal weight cats, so the most important thing a cat owner can do to decrease their risk of developing diabetes is to maintain a healthy weight and encourage physical activity through daily play. Clinical signs. The 2 most common signs of diabetes noticed by owners at home are weight loss despite a good appetite and increased thirst and urination. Weight loss may be noticed at home or during a routine examination with the veterinarian. In both type 1 and type 2 diabetes, the cells in the body are unable to absorb glucose from the blood and become starved of energy. To get the energy it needs, the body turns to other sources, breaking down fats and proteins to feed glucose-starved cells. This breakdown results in weight loss, despite an increased appetite. Excessive thirst and urination can also signal diabetes in a cat. High levels of sugar in the blood can overwhelm the ability of the kidney to filter glucose, allowing sugar to spill out of the blood and into the urine. This high urine glucose concentration can actually pull excessive amounts of water into the urine, resulting in increased urine volume, increased urinary water loss, a propensity for dehydration, and a compensatory increase in thirst. In rare cases of uncontrolled diabetes, cats may experience damage to the nerves in the hind limbs, resulting in a plantigrade stance of the hind limbs, walking or standing with their hocks on or close to the ground. This is not painful, and will often resolve with treatment. Diagnosis. Your veterinarian will diagnose diabetes mellitus by demonstrating persistently elevated glucose levels in a cat's blood and urine. This testing, along with consistent clinical signs, will lead to the diagnosis of diabetes. A single blood glucose reading in a veterinary clinic may not be sufficient to diagnose diabetes in all cases. Cats can develop a short-term elevation in blood glucose as a response to stress, known as stress hyperglycemia. In these uncertain cases, a lab test known as a fructosalmon concentration can be helpful. This test gives a rough average of a cat's blood glucose concentration over the last 2 weeks, so would not be affected by stress hyperglycemia. Other tests will likely be recommended by the veterinarian to rule out other diseases which might be contributing to a cat's clinical signs, such as a urinary tract infection, chronic kidney disease, pancreatitis, or hyperthyroidism. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. Treatment. The main goals of treatment for feline diabetes are restoring normal blood glucose concentrations, stopping or controlling weight loss, stopping or minimizing signs of increased thirst and urination, avoiding inappropriately low blood sugar due to treatment, hypoglycemia. These goals are best achieved through a combination of insulin and dietary therapy. Insulin therapy. Injectable insulin is a mainstay of treatment for feline diabetes. Unlike humans with type 2 diabetes, oral medications to reduce blood sugar such as glipizide have not shown to be consistently effective in cats. There are multiple types of insulin preparations that can be used for cats in the treatment of diabetes, such as Lent insulin, Vetsulin, Pro-Zinc or Glargine insulin. These types of insulin vary in cost, duration of action, and concentration, so it is important for an owner to discuss the pros and cons of each type with their veterinarian when deciding which insulin is best for their cat. It is also important to note that each insulin type has a specific syringe size, U100 or U40, so it is vital that cat owners ensure that they are using the appropriate syringe for their cat's insulin. Insulin injections are given under the skin, subcutaneously, approximately every 12 hours. While giving injections may seem daunting, most owners can be taught to administer these injections at home quite easily, and due to the very small needle size, cats tend to tolerate these injections very well. Though ideally injections should be spaced 12 hours apart, varying injection times by 1 to 2 hours when needed will not adversely affect a cat's treatment. Dietary therapy. A diet low in carbohydrates has been shown to improve blood sugar regulation in diabetic cats. There are several prescription food options that are available in both wet and dry food forms, though feeding a wet food-only diet may be beneficial for many cats. For cats who are overweight when diagnosed with diabetes, slow, controlled weight loss under the close monitoring of a veterinarian is very important to achieve better control over blood glucose levels. The optimal timing of meals for diabetic cats is controversial. Many veterinarians recommend feeding at the time of insulin injection to avoid a dangerous drop in blood glucose levels. However, there is no definitive evidence that the timing or frequency of meals in diabetic cats protects them from insulin-induced hypoglycemia. With a low-carbohydrate diet, free choice feeding may be acceptable for cats who prefer to graze throughout the day, especially if a longer-acting insulin preparation is used. If food must be withheld for any reason, such as an anesthetic procedure, it is generally recommended to give 50% of the usual dose of insulin, with careful follow-up monitoring to ensure good glycemic control. Monitoring. Close monitoring by both the owner and the veterinarian is an essential part of treatment for a diabetic cat. Regular monitoring will help determine the ideal insulin dose for each cat, as well as help avoid complications, such as hypoglycemia or uncontrolled diabetes and diabetic ketoacidosis. Regular assessments of weight, water intake, and appetite should be recorded to help determine if treatment goals are being met. Blood glucose curves are the ideal way to monitor blood sugar regulation during treatment. During a blood glucose curve, the cat's blood sugar will be checked right before receiving an insulin injection, and then every 1 to 4 hours throughout the day. This helps make sure that the average blood glucose is within an acceptable range, and that the value does not drop dangerously low at any time throughout the day. These assessments may need to be performed every few weeks when a cat is first diagnosed with diabetes in order to determine the appropriate dose of insulin, but can be spaced out further once the diabetes is more well regulated. Even in a stable cat, blood glucose curves should still be performed every 3 to 4 months, as insulin needs can change over time. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.